Many of my male patients have an embarrassing problem that they're ashamed to ask me about. I'm talking about gynecomastia. The term comes from the Greek words gyna, meaning woman, and mastos, meaning breast. In practical terms, this means abnormally large breasts on males. In pop culture, you hear terms like man boobs and other slang terms for this really bothersome condition. Gynecomastia can affect one or both breasts, sometimes unevenly. The condition is relatively common in adolescent boys, and 90% of the time the symptoms disappear in a matter of months or as adolescence wanes a few years later. But the remaining 10% are burdened with a social handicap that causes a deep and complex shame and puts one's relationship with one's body at risk. There are several potential causes of gynecomastia: puberty, steroid abuse, obesity, tumors, genetic disorders, marijuana use, chronic liver disease, and many different medicine side effects are just some of the most common causes. Several health conditions can cause gynecomastia by affecting the normal balance of hormones. Some tumors, such as those involving the testes, adrenal glands, or pituitary gland, can produce hormones that alter the male-female hormone balance, which can also lead to gynecomastia. Malnutrition and starvation can cause gynecomastia because when your body is deprived of adequate nutrition, testosterone levels drop, but estrogen levels remain constant, causing a hormonal imbalance. Even some herbal products such as tea tree oil or lavender in shampoos and lotions can cause this condition. In cases of obesity, weight loss can alter the gynecomastic condition, but for many it will not eliminate it. For all other causes, surgery is the only known physical remedy, and for many men, this is the best solution. That accomplishes step one of the healing. The biggest problems from gynecomastia are the psychological issues. This condition can be emotionally devastating. Feelings of shame, embarrassment, and humiliation are common. A man or a boy with gynecomastia struggles with anxiety over such simple acts as taking off his shirt at the beach or daily PE at school. Step two of this is psychological redress. From childhood taunting to a lifetime of hating his chest, the hurt feelings will not go away with the fact of breast reduction alone. It is important to recognize the scars on the inside. This is difficult work because it means coming to terms with one's body and past, acknowledging the pain, moving into a new relationship with one's body, and changing how he thinks the world sees him is the key to healing and freedom. Men often have a very difficult time talking about this breast situation to anyone, but it's the first step towards relief. So if you are at home watching this, I want you to do something about this now and make sure you get some counseling after your surgery to really start the healing process. I'm medical editor Dr. Corey Hebert with your Weekend House Call.